This is Dr. Anirudh. Hope you all are keeping well in this pandemic situation for this COVID-19, and you are all are keeping well with hygiene, proper hygiene and other sort of amenities. And I'm really overwhelmed with your responses which you have all given for my first video regarding the knee pain. And today I'm going to explain something about shoulder pain about one of my patient who is my old patient, but she has recovered very well. And the video will be regarding the different types of shoulder pain. But today I'm going to explain something about impingement syndrome. Shoulder joint, as you all know, is consist of four type of muscles, consisting of supraspinatus, infraspinatus, teres minor, and teres major. So these are the four main muscles which comprises the shoulder joint, and any pain which relates to the shoulder joint consists of either shoulder dislocation or any inflammation of these particular muscles. So today I am going to explain something about the types of shoulder joint. You just look at me what I am going to show you. See, from this 0 angle to 10 degrees or 15 degrees, if the pain comes in this angle, it is said to be as supraspinatus tear. But if the pain comes from 15 degrees to 40 degrees, that is said to be frozen shoulder. That is quite common nowadays because you all know that what is frozen shoulder. But when the pain comes from 40 degrees to 120 degrees, that particular area is said to be painful arc syndrome, which I am going to explain today regarding how to treat the patients and how to reduce the pain and what are the means by means of which the patient gets recovered soon. Look at me, this is my patient, and I'm going to show you some techniques, some glides which we used to do initially before going for the further process of the exercises and all. So before going for this glide, I just want to tell you something about the pain. What are the ways by means of which we used to treat the pain, by means of icing, cryotherapy, or by heat application, or by various electrical modalities. That is a separate part. But this is the area where I'm going to focus on, which really helps the patient to recover very well and very soon within a very small spell of time. Just look at me what I'm going to do. Initially, in this particular joint, I'm going to show you what is said to be glide. So this is anterior-posterior glide, which I'm going to show you. See, the pressure should be evenly kept over the shoulder joint, and with one hand you need to pull the elbow up, and the pressure should be even, near about 10 to 15 times. Likewise, you need to put the pressure. The second one is superior glide. In this particular technique, what you have to do, you have to just slightly pull the arm, and with the other hand, you need to glide the shoulder joint. This is said to be superior glide, which helps for the flexion movement of the shoulder joint. This is very effective, and this also can be given for 10 to 15 times. Okay, now let's concentrate on the other one, that is said to be inferior glide. So in this particular case, you need to stabilize the shoulder joint, and you need to slightly pull the shoulder towards yourself. So this is said to be inferior glide. So this glides helps the initial aspect, how to improve the range of motion. Now after doing this glides, we need to do the internal and external rotation of the shoulder joint. So how to do that? You need to put a pressure over this area, and you need to ask the patient to put the arm in this way as well as in this way. Okay, just look at me what I am doing. Okay, I think you can observe my movement, what I am going to do. Just look at me properly. Okay, fine. After this, I want to ask the patient to sit. Then now So in this particular movement, this is said to be the supraspinatus and infraspinatus technique, by means of which we need to give some MFR and MET technique for this particular patient. So just look at me, what I'm going to do. I'm just putting my finger in this way and I'm just pressing this area, the supraspinatus muscle, and I'm asking the patient to put the arms downwards like this. So this movement is said to be, this is the technique for the supraspinatus muscle. Maybe for about 10 to 15 times. Same way, we can ask the patient to hold the arm in this way, and she needs to put it in the forward direction. At the same time, what I am going to do, in this particular movement, I am going to show you the MFR technique in the infraspinatus muscle. This area is the infraspinatus muscle, and the patient is moving the arm in the forward direction, and I am giving a slight pressure in her movement. The same way, this is said to be MFR as well as MET, both technique together. So this helps the patient to improve the range of motion from 70 degrees to 100 degrees in abduction. Thank you so much for observing my video, and if you like, you can subscribe in my channel and you can like my video. I'll be very much happy if you all subscribe, and in my further videos I'll be teaching you something else from the other joints. And my contact number is 9477089899. I repeat, it's 9477089899, and my email ID is Anirudh, ANIRUDD 77 @gmail.com. So in this particular movement, I am going to show you the MFR technique in the infraspinal